primary headaches has taken a lot of our time, but then it's very very important to note what a pathological headache is, and then also to be able to differentiate it from a physiological headache or primary headaches. That is headache without any pathological origin. All right, so this is the final one we are doing. The reason I place this one as the last one is basically how uncommon it is and how severe it is. Anything that is not common, anything that is rare, if that thing occurs, basically it means it's going to be very difficult to deal with, because basically it's not common. So we've not been able to test it so much with so much of medications or so much of therapies to know how it can be dealt with. And even if we have, it's not going to be common because the condition itself is not common. So imagine you are selling something that people do not really buy. When you stop selling these things, or when you go and bring these things, it might be in your shop for a very long time and no one will come and buy it. Next time you might not purchase it. So if another person comes next time where you haven't purchased it, you might even roam to the point you not even get some. So this is how this particular type of primary headache is like, rare but then very difficult and very very severe to deal with. All right, what am I talking about? I'm talking about cluster headaches, headaches that are cluster in nature. Now, typically, this particular headache affects three specific places. It affects you at the supraorbital area. I mean, these are terms I'm going to break down into smaller pieces so we all can get it. So those who are health inclined, don't think you are the only people going to benefit. We are all going to benefit because I'm going to break it down. All right. So supraorbital side, retroorbital, and the temporal part of the head. These are the three specific places this particular headache affects the most. When you say supraorbital, supra means upper, like above. So supraorbital, where is the orbital? The orbital is basically talking about the eye area. So the upper part of the eye area. So yeah, when near cheek, that's basically how it is. Retroorbital, when near say. So that's it. I mean, supraorbital, retroorbital, that's it. When near cheek, when near say. That's it. So keep it that way. W'ani ho bɛyɛ wo ya, then w'ani akyi sei w'ani so no nso bɛyɛ wo ya paa. So keep it that way. Then we have the temporal side. I mean, this side, the temporal, where there are four lobes in the brain: the frontal, the parietal, the occipital, the temporal. Was more like Washington, yeah, that kind of thing. I don't know if the P version of it is so right, but then that's how simple I can put it. All right, this is my working area, so don't mind the blue box here. So yes, specifically, these are the three places this particular headache affects the most, and a very severe what pain. Now, this is how the presentation occurs. Anyone, anyone in this particular form of headache is one, agitated, two, restless, and three, they seriously want to get to a hospital for cure or for care. One, they are restless. Two, they are agitated. Three, they seriously want to get to the health facility for care. So you see this nice human being I've been able to put on board here. Yes, my drawing skills is very, very high. Yes, so this particular man is suffering from cluster headache. What can you see? You can see that the two hands, one of them has been raised to the nasum side, to the temporal side, pointing there. And this one is trying, I mean, he's trying to run to this place, going to what? Going to look for care. I mean, he sees this place as a first aid point, clinic, going to look for care. And you see droppings coming from the eyes, like many things you get it. Now there's one thing I'll talk about at this. So basically they are agitated, they are restless, they are looking for place for care. And then there is what? There's watery eyes, there can be watery nose. So this is the kind of presentations this cluster headache. You become restless, you become agitated, there's nasal congestion, there's nasal congestion or running nose. Then the supraorbital side can be swollen, can have edematous stem. Then another thing, there can be what you call in simple terms ptosis. W'ani bɛpiepie, then w'ani bɛtumi asan akeka akɔ mu. So there can be that kind of thing. There can be ptosis, there can be Meiosis as well. So whenever it can come, whenever PP, those things can also what? Okay, then it can be very severe pain at the supraorbital side, retroorbital, and then temporal. But one specific thing about this is that whoever in this pain is likely to point the hand, to place the hand at the site where the pain is very severe. So mostly they place the hand here, like there will be watery eyes, watery nose, lacrimation, like then Osuna and Sadan has say that's cluster headache for you. It will mess you up. It's a very severe thing to deal with. All right. So I think we've understood the presentation. Specifically, it occurs at the supraorbital, the retroorbital, the temporal, that's Weniachi, Weniase, then Wasunte. Then basically, you have the case, the person pointing the hand or putting the hand at the site where the pain is very severe. Then another thing you need to do with all these presentations we are talking about in cluster headache, always note that cluster headache is strictly unilateral. It just occurs at one side of the head. Strictly unilateral. It occurs at one side of the head. So if you basically have someone who is having all of these things and coming with pain at all sides of the head, basically it's not cluster headache. Could be something else. It could be a pathological headache. You might never know. You understand? Look for other features of the headache and make a right diagnosis. This is strictly unilateral headache. And all these symptoms like presentations like the lacrimation, the watery eyes, the watery nose, the swelling of the upper parts of the eye, that's Woniachi, the supraorbital side, all those things come at the epilateral side of the pain, meaning the same side of pain. So if the pain is at the right side, all these symptoms are going to come at the right side. If the pain is at the left side, all these symptoms are going to come at the left side. There is no way the pain will be at the right side and the watery eyes, watery nose will come at the left side. No, it doesn't occur that way. So when we say it's lateral, meaning the same site of pathology, the same site of pain, the same site the thing is occurring. So that is cluster headache for you. Now, what are the triggers of cluster headache? The triggers of cluster headache can be what? Very strong odor. You're going to inhale very strong odor and you can't even get your head around it. You understand? You can shake your head. Then alcohol and certain foods as well. One thing also about this is that mostly it takes the circadian pattern. I mean your sleep. So mostly when you are going to in the night, it's kind of a nocturnal headache. When you are going to sleep, that is when it occurs. It can even wake you up from your sleep. You understand? And one thing is that it comes in association with um, what you call the trigeminal pathology, the trigeminal nerve. That's basically the biggest cranial nerve there. So anytime there is a trigeminal pathology, there can be associated with cluster headache to it. So you kind of can't take cluster headache away from what trigeminal what pathologies. Trigeminal nerve is basically for facial sensations. So all the sensations you have on the face, I mean the touch, the breaking sensations and everything, and you're suffering from a particular headache. Basically, you can trace it to what trigeminal what nerve pathology. How do we manage this? Like I said, the best form of management is staying away from your triggers. If you've taken in some new recently taken in some new food which you haven't taken it before and it's giving you some kind of these sensations or this feeling, basically you need to stop. Then frequent intake of alcohol, then a very what strong odor. You stay away from all these things. If these people are running to hospital for care, one of the things they might need is clean oxygen. Just put the person on oxygen for 15 to 30 minutes to relieve the person of the symptoms and then take the stress away from the brain. You can also use your steroids for it. So, like I said, these ones I'm not specifically going to mention medication because the moment you abuse them, you get addicted to them. And basically, it's going to give you complications you might not expect. So, these ones have been able to at least state oxygen there. And you can't go and pick oxygen unless maybe you go and pick this one fire extinguisher and use it as oxygen when you want to do that in the house. All right, then you can do steroids as well. So this is cluster headache. Very simple, but very, very, very severe. More, I mean, you can trace it to the more reason why it's less common. Because if everyone should be suffering from this, we would have all been mad by now. It's a very severe form of pain. So don't joke with headache. Like I said, let me say this again. Many patients come to hospital because of pain, so don't joke with pain. Don't think the patient will go out of pain by themselves, so you not give a painkiller. It's very abnormal to do that. Deal with the pain. Make sure the patient is out of the pain, because that is the reason why they came there. Then start treating whatever led to the pain. You understand? All right, thank you. These were me medicals today. I hope you find this interesting. If you find it interesting, try to share the link, try to subscribe, and comment. Whichever topic you want us to also address, you can comment or put that in the comment section, and we'll do that for you.